Welcome everyone, and thank you for attending today's webinar, which will provide a 2020 update on undergraduate public health and global health. My name is Suzanne Walker, and I'm the Senior Marketing Manager for Public Health and Health Administration here at Jones & Bartlett Learning. So now, let me introduce you to our presenter. Dr. Richard Riegelman is a professor, and he's the founding dean at the Milken Institute School of Public Health at George Washington University. He is the author of the best-selling text, Public Health 101, Improving Community Health, as well as a new primer on population health, both published by Jones & Bartlett Learning. He is also the series editor for our Essential Public Health series, as well as our expanding population health primers, which are all both from Jones & Bartlett Learning. With that, I'd like to turn things over to Dr. Richard Riegelman.
Thank you. Well, the coronavirus COVID-19 has really put public health and global health at the center of the world's attention. However, long before the world focused on public health and global health and global health educators were rapidly expanding into undergraduate public health. About a month before COVID-19 burst onto the world stage, Jonathan Leiter from Johns Hopkins wrote the following quote. Note, he said, Bachelor's of Public Health is growing much faster than any other degree level, and that's really been critical. He says, there is pretty good reason to think that the bachelor's degree will overtake master's as the dominant degree award level in public health. Let's take a look at the evidence and show you what's happened over the last years. This data comes from the U.S. Department of Education, and it's been put together, as most of these other slides have been, by the Association of Schools and Programs of Public Health, ASPPH. And it shows the degrees awarded. So it's only about majors, and it's only about degrees awarded. But it goes back from 1992 to 2018, which turns out to be the most recent data that's available. And it's really interesting to see what's happened. There's been a lot of growth at the graduate level, but there's been a dramatic change in undergraduate. Undergraduates were a few and far between until this century. And about 2005, 2006, 2007, you can see a dramatic upturn and an inflection point in the undergraduate, particularly in the bachelor's degree education, the second line from the top. And you'll notice that things are moving closer and closer together. In fact, by the 2019-2020 data, the two curves, the master's degrees and the bachelor's degrees, are expected to pretty much converge. The inflection point in 2005, 2006 is interesting because I like to think it reflects two things, important events that happened. In 2006, a consensus conference was held. It was organized by the Association of American Colleges and Universities, which has long been a supporter of undergraduate public health, as well as the National Public Health Associations. And the aim of the consensus conference was to implement what was the Institute of Medicine, National Academy of Medicine recommendations that said all undergraduates should have access to education in public health. Well, in the early part of the century when that recommendation was made, that was really considered a pipe dream. It wasn't considered feasible. Today, it is feasible, and it's rapidly becoming a reality. In 2007, just as that you see that line curve up, Jones & Bartlett Learning launched the Essential Public Health series, and you're going to be hearing more about what's happened with that over the last years. You'll notice also that even though there's been enormous growth at the bachelor's degree level, that's not been the case with the associate degree at the community college level. And we're going to talk a little bit about how that's beginning to change, and we hope will be also an important factor in the coming years. So let's go on to take a look at what's happening with applications and what's happening with admissions. I think it's really quite dramatic to see not only the increase in enrollment, but in the recent years, from 2013 on, the applications have actually grown faster than the admissions or the new acceptances. And I think that's a reflection of the fact that this is truly a student-driven movement. that there really has been an interest among students, and that interest is not slowing down. Like students, I like to think that students see public health and global health as both a pragmatic future for themselves and an idealistic emphasis for changing the world for the better. So it's a unique combination of the two, and I think that's really attracted students to public health, and as we'll talk about increasingly now, to global health. So let's take a look and to see who these students are. This reflects a really stable pattern of ethnic backgrounds and racial backgrounds in terms of since in the last 5 years. And you'll notice that it pretty much reflects the makeup of the American population. So it is a reflective of the population, but probably doesn't reflect the needs of the country. So many of the important needs of the communities, of the Hispanic community, of the Black or African American communities, are still underserved and in quite perhaps in need of more than the proportion in the population. And we'll talk about some of the things that are happening in that realm as well. But this is where we stand, and it looks like, at least at the bachelor's degree level, it's pretty stable. So let's look a little more at who these students are. As you can see, it is increasingly and predominantly female, about 2 to 1 or more, and that's becoming the pattern in many health professions. And certainly we see that at the undergraduate level in public health. It's a U.S. phenomena. It's not particularly emphasizing the foreign nationals who come to U.S. institutions for education, and that's reflected on the right-hand side. So what are the programs that they're pursuing? Let's take a look at that. What's changed dramatically from the 2006-2007 period when things really took off is that generalist, what would have been called the educated citizen model, the liberal arts model of undergraduate public health education, is what's really grown dramatically. In the 20 years ago, it was really non-existent, and today it represents by far the largest area. And that's consistent with the concept that undergraduate public health is increasingly becoming a generalist degree, whereas graduate is increasingly being looked at as a specialty degree. And so that distinction is increasingly made. But there are specialty areas within undergraduate public health education, the largest of which is health education specialist degree. And that includes the CHEST certification and the process. And that's been the fourth line down there, quite stable. And an important part, but not as rapidly growing as the generalist model. Let's take a look at the what's happening with where people are going. What's happening when they graduate? Well, what's clear is that many of them, most of them, about 2/3 of them, go seek employment. Now, they may not seek employment they may come back to school, so we assume that the continuing education effort is larger than it looks here. But basically, this is the first year out. And it reflects the fact that employment is the predominant activity, but continuing education is also important. And that continuing education includes about over 40% of those who are going on for education are going on to graduate work in public health, but another third of them are going on to clinical education. And I think that's important because what's clear is that public health and global health are becoming preparation not only for public health, but for a whole range of clinical disciplines, from nursing to medicine to pharmacy to dentistry. But they're also becoming preparation for law and business and international affairs. And I think one of the unique parts about undergraduate education, public health and global health, is that it really is both a liberal arts education and the potential to develop a graduate and specialty route. So I think you'll see that. Let's see where these people are working. And you just see here the division, the medical clinical and the public health. So let's look at the next slide that takes a look at where they're going. In the early days of undergraduate public health, people said, oh, undergraduates are going to take away the jobs of the graduate, and there was quite a bit of concern about what's going to happen. Well, it's interesting to see that pattern is now beginning to form. And the employment for undergraduates is really quite different to the employment for graduates. The employment for undergraduates is for-profit and healthcare system and nonprofits, and only a small percentage into governmental public health and academia. And that's quite different than the graduate employment. The predominant graduate employments are government, academic, and nonprofit. So we're seeing that there's some overlap, but I think actually surprisingly little. In fact, the kinds of jobs that people are getting are really quite different than graduate jobs. The University of North Carolina School of Public Health did a very interesting study a couple of years ago in which they looked at, followed up carefully their graduates, and they found that the undergraduates did go mostly into for-profit healthcare, nonprofits, and many of the jobs that they took weren't called public health. They weren't called global health, but the students felt they were using their skills, they were using their public health training, and they saw it as public health, even though their employers may not have recognized it as public health, may not have promoted it as public health, yet the skills in public health education are so broad that the employment opportunities are quite wide. So I think that you're hearing less and less about the concerns that were initially raised, that bachelor's degree students are going to be competitive directly with graduate students. What's interesting in the next slide, this also shows the fact that when they do work in government, they work at all levels. One of the things, and that's the colored wheel there. In the next slide, you'll see what is, I think, surprising to many people, and that is that the entry-level salaries, regardless if they go into for-profit, self-employed, government, healthcare, are really not that different. A well-educated bachelor's degree student tends to have their salaries in the 30s, and the variation between where they go is not that different. So these are well paid, but perhaps, as you know, nobody gets rich in public health. But they're good, solid, and jobs with a really, in many cases, a very exciting future. So where are the programs that they're going to? Well, this is what you see here is a slide that was put together by the ASPPH in the early days of undergraduate public health, and it shows even in the first 100 or so programs that they were all over the country, and that pattern has continued. You'll see that the programs are where the people are. And that's a good thing because it really means this is not a local regional phenomena. This is a national phenomena, and I think that's reflected in that in what you're seeing in front of you. So now that it is a national phenomena, what's being done nationally to both ensure the quality of the programs and to a certain degree the uniformity of the programs? Well, there are a couple of things I want to talk to you about. I want to talk to you about the accreditation process and also the certification process. The accreditation process began early in the growth of undergraduate public health, and it started actually ASPPH, Association of Schools and Programs of Public Health, in 2011. Published what is still referred to as the essential learning outcomes. And the essential learning outcomes form the key components of an undergraduate major. And those essential learning outcomes were taken on and largely absorbed by the Council on Education for Public Health, which is the formal accrediting group for public health. And the first thing that CEPH did was to accredit the bachelor's degree programs that exist within schools and programs of public health. And the vast majority of CEPH accredited schools and also programs are their undergraduate programs are part of that accreditation or an add-on to that accreditation. And so that the core programs in schools and programs number over 200. And if you want more information on that, I've included the URL. But what's really new and important, I think, in the last few years is the growth that has occurred outside of schools of public health and programs of public health. And they are, it's estimated there are almost as many bachelor's degree programs outside of schools and programs. That means that these are often in liberal arts school institutions or state universities that do not have graduate public health. So that today at the undergraduate level, there are basically almost an equal split between undergraduate programs in established schools and programs, as well as in what is now being called standalone bachelor's programs. The term standalone bachelor's programs is what CEPH refers to when they refer to undergraduate programs that do not have any graduate program at the same institution. And in the last few years, CEPH has put forward a accreditation program for standalone bachelor's programs. And it's just beginning. The initial group, there were 16 standalone programs that were accredited, and the second round, there are 14 more that are in the application process. And just to show you then the next, where these are, you'll see in the next slide, this is the initial 16 organizations that are that were reflected as standalone bachelor's degree programs. And that's growing, but it still is a small percentage of the total undergraduate programs that exist. Let's go on to look at the certification process. Certification, as opposed to accreditation, is about the individual. And about a decade ago, the National Board of Public Health Examiners was formed that now certifies people in public health. It's called Certified in Public Health, and it's a formal credential. The credential is designed to test not the specialty areas of public health, but much more general principles. And the original use of the certification was at the graduate level, but in the last few years, it is now bachelor's degree graduates are also eligible, but do require 5 years of public health work experience before they can take the exam. And that work experience needs to be related to the 10 essential public health services. I think it's interesting in the next slide to look at the areas that are covered by the what is now called the CPA exam, because they don't look at all like the traditional emphasis in public health on the 5 disciplinary areas. It has 10 different areas, all with of equal weight in the exam, and they range from evidence-based approaches to public health, communications, leadership, law and ethics, public health biology, and then management and planning activities. You can see that on the right, the program planning and evaluation and management and policy, as well as an increasing emphasis on health equity and social justice and collaboration. This looks much more like the typical undergraduate program than it does at the graduate program. And I think that's one of the ways that undergraduate is having an influence. It is much more interdisciplinary, much more oriented to getting things done in a practice setting. And I think that is that's what you're seeing. There's the direction that things are moving now in both undergraduate as well as graduate public health. Okay, let's step back and let's take a look at some of the new and developing trends that are occurring in undergraduate public health. We're going to look at 5 different areas and talk to you a little bit about some of the coursework changes and new opportunities that I'm seeing. Some important work that's happening in the community colleges in public health. The development of the ASPPH undergraduate network for both public health and global health, and then the emergence of global health education in the United States as probably the leading growth area that is that's continuing now. And finally, public health as preparation for medical school, which is now very much accepted as part of the preparation for medical education. So let's start with the coursework. And I think one of the things that's changed that we're seeing is that in the original learning outcomes and the original emphasis in undergraduate public health, research methods were not included as a major focus area. And but that's beginning to change. And one of the new additions to many of the programs is a research methods course. And I think you'll see that as important, but also as a useful transition to graduate education. Probably the most dramatic thing we're seeing is with the changes in two fundamental areas. COVID-19 and climate change are certainly on everybody's agenda, and often the concept of One Health curriculum, which combines the human health and animal health and the health of the environment, is becoming an umbrella for some of these major changes that are occurring all around us. So these are people are trying to figure out how to integrate these into introductory courses and into specialty courses. And people are including them in environmental health, they're including policy courses. They are not usually standalone curriculum, but they are beginning to be able to be integrated into a variety of different courses. And so the concept of primers is becoming an important way to introduce these concepts integrate them into larger curriculum. The third direction that is beginning to change is that the clinical disciplines, from nursing to medicine, pharmacy, physician's assistants, allied health, have taken on public health in many ways, but called it population health. And population health is often seen as a way to combine and connect the public health system and the clinical healthcare system. And these have long been in great need of connections, and as many of you know, haven't always worked together so well. But the concept of population health, I think, is beginning to make that possible, and the clinical disciplines are beginning to buy into courses that are often called population health, and we'll be talking more about that. I think this provides unique opportunities to get public health more broadly integrated, and opportunities for many programs to get known and get recognized across the university. So let's take a look at the next component, the community colleges in public health. Now it's interesting that until recently, public health and global health really were unknown disciplines at the community college level, and that's unfortunate. Because that's despite the fact that the community colleges are made up of students who come from communities that are in great need of public health. Today, community colleges are majority minority. The majority of students now come from communities in need, often Hispanic and African American Black communities, and they are the kinds of students who really could make major contributions to public health and change the nature of the public health workforce. So we think that community colleges are going to become an increasingly important locus for public health education. Now, fortunately, the major academic organization in community colleges, called the League for Innovation in the Community Colleges, usually called the League, has really taken on public health and really spearheaded the efforts of community colleges to get public health on the map. And they've worked closely with ASPPH, also with SOPHE, the Society for Public Health Education, and developed a number of programs that are in the takeoff stages at this point. One is a small grant program. And this year, they've awarded over 30 small grants to community colleges for student programs as part of National Public Health Week, this year, April 5th through 12th. These grants are supported in part by Jones and Bartlett Learning. An additional round of support will occur in 2021, and the first occurred in 2019. Over the 3 years, we expect that there will be something like 100 small grants and 100 institutions, community colleges, that will have had some exposure to public health that didn't exist before, and the focus has been on National Public Health Week activities. In addition to the small grant programs, last year and now this year, there will be a National Public Health webinar on the Thursday of Public Health Week, April 9th from 2 to 3 this year, and sponsored by ASPPH, by the Society for Public Health Education, and by the League for Innovation in the Community Colleges. And the theme this year will be Pathways to Public Health. So it'll look at how community colleges can connect with public health with bachelor's degree programs. And registration will begin in mid-March, and the ASPPH is organizing the logistics, and they can be reached. Registration will be available in mid-March at www.asppph.org. Finally, the ASPPH organized several years ago the Framing the Future project. And one of the reports that came out of the Framing the Future project was the Community College and Public Health report, which was done in collaboration with the League. And the report recommended 3 what was called health foundation courses that were considered to be important courses to offer at the community college level, both in for their own sake, but also to prepare for transfer to bachelor's degree programs. And these courses basically are personal health with a population perspective, an overview of public health, and health communications. And these 3 courses were designed to be preparation not only for public health, but for health professions, education in general. Community colleges are really quite strong in pre-health professional education, particularly in nursing and a number of allied health professions, so that there is a student body that could certainly be introduced and benefited by the health foundations courses. So let's take a look a little bit at the efforts that have been done to expand undergraduate public health education. One of the most exciting activities has been what's been done by ASPPH, and they have begun and now have well established an undergraduate network, and they call it Public Health and Global Health Network. And it is open to bachelor's degree programs in schools and programs, but also to those who are not. Do not have a program or a school at the graduate level connected with them. And they have almost 200 programs and undergraduate programs as part of that network. And that's a growing and important activity. And I've given you the URL for more information on that as well. ASPPH also sponsors an annual undergraduate summit. And that will take place this year on March 18th, the first day of the ASPPH annual meeting in the DC area. And it's open to all undergraduate public health faculty. The 2021 meeting is scheduled for Wednesday, March 24th, for those of you who are planning ahead. It'll also be in the Washington area, and also the first day of the ASPPH annual meeting. So this is a tradition now that goes back almost a decade, and it's really a unique opportunity for faculty to interact, to get some new ideas about what's happening around the country. And they've had more than 200 program attendees, almost limited only by the space available. And finally, the ASPPH has a new program called Student Ambassadors, and the Student Ambassadors are graduate students in public health whose job it is to try to spread the word on public health education. And there are now about 50 of them. And they are beginning to work with the community colleges, but they're also you can request their participation at institutions and either virtually or in person to make presentations and to participate in activities in at programs around the country. The next issue is the issue of global health education. And as I said, global health education is now probably the biggest growth area within public health. And it is really booming in many areas, and particularly in liberal arts education. Because it really does combine the liberal arts education concepts and allows for considerable flexibility in how the curriculum is developed. And increasingly, undergraduate global health has become an equal partner with public health in undergraduate public health education. In fact, there is now a summer institute for undergraduate curriculum and course design in global health called Teach Global Health, sponsored by Allegheny College, now on an annual basis, and this year, June 16th to 18th. And it's being presented this year in collaboration with ASPPH, AAC&U, and also Johnson Bartlett Learning. So you can learn more about and register if you wish to for Teach Global Health at the URL there. And finally, undergraduate public health is being recognized around the world. In fact, ASPPH is now developing strong relationships with other educational associations, particularly ASPR, the European Public Health Association, and the Asian Pacific Public Health Association, and we'll soon have an online community created across these three organizations. And the first formal project that is being done in this area is This is Public Health Europe. This is Public Health is an activity that was developed by ASPPH to promote public health and get the people to understand more about public health, both to students and the community at large. And it's been extremely successful in the United States. And it is now, they are now sponsoring jointly with ASPR a program for Europe. And there will be 9 initial programs that were funded in 2019-20, and there will be approximately that many more sponsored and supported in 2020-21. So undergraduate public health is grown enormously in the United States, but is now beginning to be recognized and to grow around the world. And finally, public health is becoming a formalized preparation for medical school. And I thought it was interesting, the quote in the U.S. News and World Report: gaining experience in public health education is important before you enter medical school. 10 years ago, 15 years ago, you wouldn't hear that. Today, it's becoming an accepted fact that public health is a critical component of and the basis for medical education and clinical education in general. And undergraduate public health courses, majors, and minors are now encouraged as preparation for medical school. The MCATs since 2015 now cover health behavior and basic study design and basic biostatistics. So there is some practical reasons for pre-medical students to be interested in studying some of these areas. And epidemiology, health policy and management, as well as health behavior courses are increasingly encouraged as preparation for medical school. I think one of the key elements here is that medical school has really, and other clinical disciplines, have really taken on population health as part of their curriculum. And the population health component really provides a continuum from undergraduate preparation through the integration into medical education and into clinical education. And people are beginning to see how the underlying public health principles are critical to serving the larger populations. And so that clinical education is no longer so isolated as it was for so many years from public health education. Finally, to look at some of the opportunities to connect. I have for you some of the major organizations we've talked about in their URLs. ASPPH, Society for Public Health Education, SOPHE, AAC&U, and their listserv that has over 400 people on it, and the League for Innovation in the Community Colleges, the League, as well as the Council on Education for Public Health. I look forward to taking your questions and interacting with you in a few minutes. But first, I'd like to turn it over to Suzanne Walker, who's going to talk to you a little bit about the Essential Public Health Series and population health.
Thank you, Dr. Riegelman. As I mentioned at the beginning of this presentation, Richard Riegelman is the series editor for our popular Essential Public Health Series. Here are some of the titles in this series. However, the series is pretty broad. It has about 20 titles which span the undergraduate public health curriculum, from introductory courses in public health and epidemiology and global, to healthcare ethics, public health research methods, health information systems, and others. What has made this series so successful is that it's written specifically for undergraduates and offers a clear and consistent approach that really brings public health to life through case studies, short vignettes, real-life examples, lots of tables, graphics, and visuals. It is also written by authors who are well-known experts in their field. For example, Bob Fries is the author on the epidemiology text, Lisa Sullivan on biostatistics, Sarah Walensky and Joel Teitelbaum on health policy, and there are other names that you'd surely recognize. Not only is this designed to meet the ASPPH and AAC&U recommendations for undergraduate public health education, but it meets our rigorous requirements for producing quality materials for teaching and learning. We are consistently updating and publishing new titles in the Essential Public Health series. In the fall, we published a new 4th edition of Richard Skolnick's popular text on global health and a new title on managing public health organizations by James Johnson and Kim Davey. This spring, we will be publishing a new edition of Bernard Turnock's Essential Public Health text, and that's updated by a new author team, including Guthrie Burkhead, Cynthia Morrow, and Sylvia Pirani. We also have a brand new research methods text focused uniquely on public health research methods, and this is written by Richard Crosby and Laura Salazar. Given the interest in undergraduate public health teaching resources, we've created a website that not only showcases the text in the Essential Public Health series, but offers additional resources for undergraduate public health. In the resource section on the site, you'll find useful links and different documents to download. In fact, there's a handout today, and you'll see it on the right-hand side of your screen. And that's an updated version of one of the resources on the Essential Public Health site, and includes valuable undergraduate resources and links to interesting articles. And finally, I want to make you aware of our growing series of population health primers. We currently have 2 titles available: Population Health, which came out in the spring of 2019, and Biostatistics for Population Health, which will be out within the next month. In addition, we'll have 4 more coming for fall of 2020 on climate change and population health, global population health, opioids and population health, and health information systems for population health. These short 100 or so page texts can be easily used across the health disciplines for a short course or to supplement a longer course, and can be easily bundled with any Jones and Bartlett Learning text for an additional $15. With that, I really want to thank everyone for joining us today. If you have any questions about anything, please feel free to reach out to me or Dick. His email is on this slide, as you can see. And with that, I would like to conclude today's webinar. Thanks all for attending.